this is the iCare exam cam, and we have implemented it into our Manoa Care Home. And here at the care home, it's really hard for some of our patients to get out to see their doctors. And the technology has enabled us to connect our patients with their physicians. It's really easy to use. It's very lightweight. And you just go ahead and click it on with one button. Okay, so we have used this camera on some of our medically fragile patients that have entered the care home. And what we've done with those patients is connect the physician to the patient when we've got clinical issues. We have used the video camera in another patient situation where we had a G-tube granuloma, and the physician was able to virtual coach the RN on how to go ahead and cauterize the G-tube granuloma. And what was really, really neat about that is the registered nurse right there at the bedside with the physician watching could go ahead and guide and coach the nurse on exactly what to do. And we were able to go ahead and nip that in the bud, take care of that problem right away, and our patient never had to leave the home. She did not have to go into a doctor's office, and we were able to take care of it within a half-hour time at the very most to get that taken care of. The other great thing about using the iCare exam cam in the care home is when we do have a problem, from the time that it takes for me to go ahead and see the patient, contact the physician and get the physician involved or any care specialist that we need, it literally is done within 2 minutes time that we're able to make the phone call, connect with them and get the camera powered on, and the physician on the other end of the camera making their assessment and diagnosis. Had we not had the iCare exam cam, what would happen in our patients who have these clinical problems like the G-tube granuloma, we would have had to have called for special transport to come and pick the patient up, take the patient to the ED. From the ED, which could oftentimes take anywhere from 3 to 8 hours of sitting there for our turn to be evaluated, we were able to go ahead and get this done within 30 minutes time. So that saved our patient the inconvenience and then the hardship of getting from the home to the ED, hiring special transport, sitting in the ER from anywhere from 3 to 8 hours if we were lucky, and then to go ahead and get that cauterized, which literally took 10 to 15 minutes to do, and then come home. So having the iCare exam cam here in the home saved my patient that process. And at the same time, for me as a registered nurse, it was great to be able to take care of that problem, get the intervention done, and connect our patient and their physicians and care teams, almost instantaneously. Access was totally enhanced by use of the iCare exam cam.